In sickle cell disease, erythrocytes or red blood cells stick to the inner wall of blood vessels, eventually clogging them and reducing the blood flow, a condition known as vaso-occlusive crises, VOC, that includes pain. Monitoring the pathological adhesion of red blood cells to the blood vessel is thus considered a useful means to diagnose and study sickle cell disease. In one approach, the focus is on the binding of very late antigen 4 or VLA4 of immature red blood cells to the vascular cell adhesion molecule 1 or VCAM1 of vascular endothelium. Recently, researchers at Functional Fluidics have developed a clinical bioassay to measure flow adhesion of whole blood to immobilized VCAM1 or FAWB-VCAM adhesion biomarker. To improve the clinical adaptability of this method, they have now assessed the variability and predictive value of FAWB-VCAM adhesion biomarker in a 2-year longitudinal observational study. In this study, they examined their VCAM adhesion biomarker and VOC pain status of non-sickle cell disease healthy participants, participants with sickle cell traits, and individuals with sickle cell disease at steady-state home visits. They found a strong relationship between FAWB-VCAM and sickle cell disease severity. The adhesion indices were significantly lower in individuals with sickle cell disease receiving hydroxyurea. The adhesion indices increased in patients during VOCs. At-home VOCs had significantly higher FAWB-VCAM than steady-state and healthcare VOCs. Individuals with sickle cell disease who had pro-adhesive phenotype at steady state experienced greater sickle cell disease severity during the 2-year follow-up period. This study supports stratifying individuals with sickle cell disease based on steady-state FAWB-VCAM and suggests that FAWB-VCAM may be a plausible surrogate endpoint for sickle cell disease severity.